Hey, this is Dr. Joseph, Vail-Summit Orthopaedics, and today I'm going to discuss a common nerve injury or nerve problem, let's call it, that's around the elbow. The term for it is cubital tunnel syndrome. And the cubital tunnel is a small little tunnel that lives right on the inside of your elbow right here. It's where your funny bone lives. It's where, and that's what people call it because you're humorous, but it's actually the ulnar nerve. So the ulnar nerve lives right there where people hit their funny bone and get that zinger when you bump it wrong. And so it lives right down in this little notch right here, and the nerve is called, again, the ulnar nerve. That nerve becomes kind of superficial right in this area, which is of course why you could bump it. Now some patients, and it's usually not from an injury, usually it just comes on out of nowhere, they'll start to notice, especially at night, that they have increased numbness and tingling. So the increased numbness and tingling is typically one of two things. If it's in these three fingers, right here, then it's typically carpal tunnel syndrome. So that's different. That's in your wrist, and that's really common. If it's in these two fingers, especially the little finger, then it's typically coming from your elbow, and that's the ulnar nerve. And of course, that's the ulnar nerve's distribution. So when you zing your funny bone, you can even tap it and feel it yourself. You'll feel it down to your little finger. And what patients report is an annoying pins and needles that burns and wakes them up, and sometimes it's even during the day. Typically, it's when you flex your elbow, so you bend it way up, and this nerve has got to come all the way around the corner, and it makes it tight there. So that usually makes it worse. So patients that sleep with their arm like that, they'll wake them up, and they'll want to shake it out and say, I got numbness and tingling there. So the treatment for it at first is conservative with ice, anti-inflammatory, with or without therapy. Some people advocate nighttime splinting, where you're trying to splint the elbow out straight to where you're not able to bend it up. But a lot of patients, it doesn't work with conservative treatment, and it keeps on going. And if it keeps going and it's annoying them enough, then the treatment for it is to take the pressure off of the nerve. And the way we typically do that is through an incision right over that little nerve, and we find a little tube. It's like a fibrous tube that it lives in, and all we do is pop the top on it or release the compression on that nerve. And most patients say even that night that it feels better, or it feels differently better the night of the surgery. It's a predictable surgery that tends to work, but it's not super common. The carpal tunnel surgery on the different nerve here is much more common, but it's the same idea. You just give room for the nerve to breathe in there, and then it tends to work. And so if patients have increased numbness and tingling, especially to the little finger, with elbow pain, it's typically cubital tunnel syndrome or that ulnar nerve. And so if that becomes persistent, come see us at Vail-Summit Orthopaedics, Dr. Joseph.